And welcome back. Well, as part of the Affordable Care Act, people can purchase insurance through the new healthcare marketplace. Enrollment starts October 1st, which is next Tuesday.
And joining us now to explain how it affects all of you on Medicare is Lisa Lamkins. She's the Federal Issues Advocacy Director for AARP Wisconsin. She's going to help us break down a rather complicated topic. Great to have you.
Thank you.
This morning. Thank you so much. Let's talk about the new healthcare marketplace. What is it, and what's the easiest way for people to understand what they need to know?
Well, one thing that's important for everyone to know is that we actually do have a new health insurance marketplace here in Wisconsin. And really what it is, it's an online shopping mall, if you will, for health insurance. Kind of think about Travelocity or one of those online websites. It's a place where people can go, compare different kinds of private insurance. And for those people who don't have insurance or maybe who've been buying it on their own, it's a place where they can get affordable health coverage.
Okay. So, you know, a lot of places when you go on their websites now, they do give you side-by-side comparisons. So is it different than that? Is it just a one-stop shop? Or is there changes to those healthcare plans?
Well, this is what's really great about the new health insurance marketplace is that for the first time ever, people will really be able to do apples-to-apples comparison. All the plans have to cover very similar things. There are 10 essential health benefits they have to cover. There are different levels of coverage. It will be very easy for people to understand what they're buying, how much they're going to pay for it, and what kind of coverage they're actually getting for that.
Okay. What about people who are currently on Medicare? What do they need to know about this new marketplace?
I'm so glad you asked about that because we're getting lots of questions at AARP from those folks. And one thing people on Medicare need to know is they don't have to do anything with the marketplace. If you have Medicare, you will not purchase any insurance through the marketplace. No Medicare supplemental plans will be sold in the marketplace. There'll be Medicare open enrollment like there always is that starts October 15th, runs through December 7th. People on Medicare keep doing what they've always done.
Okay, that's an important thing that I think is worth repeating. People on Medicare, this does not apply to. You will not buy supplemental insurance on this in this new marketplace. This does not apply to you. Keep doing what you're doing. There is open enrollment for Medicare. It doesn't start until the 15th, where this starts October 1st.
Correct.
And open enrollment for Medicare goes through December.
Through December 7th.
Whereas this open enrollment in the new healthcare marketplace goes through March.
It goes through March 31st, just this first time around. This is a brand new thing. We're giving people lots of time to find the insurance, get enrolled in it.
So who is this for then? Who are you talking to? If it's not Medicare people, if you're watching, who needs to know about this new marketplace?
You know, people who currently don't have insurance at all, or maybe people who are on COBRA, or people who have been buying individual policies. There are actually 120,000 people just in Milwaukee County who don't have any insurance coverage. This is for them. The rates, we don't really know for sure what they'll be yet. We'll know all of that on October 1st, but all of the analysis shows that most of the people who will be looking for coverage in these marketplaces will get some financial assistance. And it's the first time ever that people have been able to get some kind of help purchasing insurance coverage.
So when you're talking to people who are on a continuation or they don't have insurance, sometimes those COBRAs and continuations have fairly good benefits because they were, you know, passed down from the company that they had been at. So if they're looking at a new insurance, are they going to have comparable coverage when they're looking at this, and is the price a lot better? I mean, you know, prices can be individuals. I pay over $300 a month for an individual policy.
And we know a lot of people who pay $1,500, $1,600 a month for some of that coverage.
Absolutely.
The coverage within the marketplace is going to be very comprehensive. It covers doctor visits, hospital visits, preventive care, mental health and substance abuse, prescription drugs. It's a very rich, comprehensive package of benefits. And there are 4 different levels of coverage, and so your premiums and your out-of-pocket costs kind of depend on which level you pick, which is great because you can decide what works best for your family within your family budget.
Okay.
Do you see, because of this, that people who've not had insurance many more people will now have health insurance?
You know, that's really one of the biggest goals of the Affordable Care Act and of these new health insurance marketplaces, is to make sure that the millions of people that we've had in this country who are uninsured finally have access to coverage. And if people get insurance through the marketplace, they can get this financial assistance. And that's what makes it doable for many families, is the ability to get help paying the monthly premiums and help with some of those co-payments and deductibles.
Okay, so for people who are interested, if you want to take advantage of the new CARE Act, here's some information as well for AARP. If you're somebody who's on Medicare or you're looking for more information, you can call them toll free at 866-448-3611 or visit online at aarp.org/WI. I know there's lots of questions when it comes to health care and senior questions as well. So there's the information for you. Thanks for being here, Lisa.
Thank you.
Really
Appreciate
important stuff. Thank you so much.